last year in March, I was going for a regular physical. Had had no symptoms, was not a smoker, and because of a chest x-ray on a pneumonia scar I had as a little girl, I was told by the doctor that I might possibly have cancer because of growth coming from that scar. And as it turned out, after many tests, I did have lung cancer. It was quite a shock, of course, devastating to Mitchell and I. And so my mind flashed back to 4 years ago when he was diagnosed with colon cancer. And I remembered then the difficult time that we had with his hydration and nutrition. Several times he had to stop treatment and lost a great deal of weight. So we both were thinking, here we go again. And I was lucky enough to get into a clinical trial, a very aggressive clinical trial here at UNC. Very blessed to be able to get in that. And when I went to see Dr. Howley, because 7 weeks of radiation was going to be part of my treatment, she pointed me in the direction of Amy, the nutritionist here, because she knew that hydration was vital for radiation. And I was very pleased to be able to have Amy right here on site. And wonderful when I met her, because I felt I finally found someone that can really help me through this. One of the most important things, I think, was to point out the fact that treatment and good nutrition and hydration must go hand in hand. And when I was diagnosed with cancer, and Mitchell, my husband, was, our first thought was treatment. This was, I must get the treatment, and I have to get the best there is, and that kind of thing naturally. But after talking with Amy, I realized that the nutrition must be there in order for the treatment to continue. That was the most important thing that she made me realize. Also, she was a wealth of information. I was able to sit down with her and find out what my body needed. How many calories would I need to take in every day? It was the first time after talking with her that I realized with chemo you must have protein in your diet, and a great deal of it. She was able to give me samples, because I realized sometimes I may not want to eat and chew and swallow. It may be that I could do it another way, and she reminded me that we could drink our meals as well as eating. She told me that the calories and the protein would help me continue my treatments, as I've mentioned. It's very important to a cancer patient that we not wait a week, and many times because of lack of good nutrition you would have to wait a week. And I also was very happy that Amy would find me when I was in treatment, in chemo or radiation, and say, how is it going? And if something wasn't going well, then I would drop back by her office before I left, and we'd think, what else can we do? So it was delightful to have her on hand all the time. I figured that if I filled this up 4 times a day with some type of fluid, could be protein drink, anything that I needed to get the calories in, the protein in, then it would work for me. And I didn't have to eat 3 main meals a day. I could drink. And so I'd start in the morning, and if I felt like eating, that was wonderful. If not, then I drank these. And I drank something out of, 4 times a day with this bottle. The nice thing about it, too, is that I could carry it with me anywhere, because it has a spout. And the spout was helpful because I found the longer my treatment went, the more tender I felt here. And so a regular swallow didn't work. And sipping did. So this spout only allows you to sip just so much. So I was thrilled to find it. And I would fill it up 4 times a day, as I said. That was one strategy. And the other one was to realize that 3 meals a day was out of the question, as I mentioned. Several small meals a day worked. And I also felt empowered because I was doing something. And I realized I had a responsibility to keep my body hydrated and keep the nutrition going so that toxicity didn't set in and treatments being missed. I was very happy to find that powdered milk worked very well. A tablespoon or two in the liquids that I was drinking added to the protein, and I tasted it very little. So that was another added incentive during the day whenever I needed it. So that was very helpful. And I found that I didn't have to worry too much if I didn't have protein drinks that appealed to me at that time. And with the samples, as I've said, that Amy gave me, I could pick and choose what tasted good that day. We have become very aware of the importance of good nutrition and hydration all the time. Because after a very strong treatment, your body has to recover. And this was a wonderful way to continue this recovery period and also to remain healthy. I think in our elder years we need to pay special attention to that. And hopefully as cancer patients we won't face that again, but sometimes we might. And remaining healthy enables us again to have treatment if necessary.